Hello, everyone. Today on Perspectives, you may not have gotten it yet, but health officials are reporting that the majority of emergency room visits in Alabama right now are for flu-like symptoms. They say that many of the ERs and even urgent cares are swamped with sick kids, and the wait times, they're long. Well, state health officials say that human parainfluenza virus and the human rhinovirus enterovirus and COVID-19 are all currently circulating throughout Alabama. And the viruses, they can present some similar symptoms as influenza. So is this a wintertime peak, as a lot of parents are asking right now, and how do you tell if it's RSV or a cold? So the health officials are saying that RSV usually begins with mild cold-like symptoms. Emergency symptoms include shortness of breath, high fever, bluish tint of the skin, wheezing, and worsening cough. Now, we are told that many pediatricians diagnose the children with a cold by asking about their symptoms and then by doing a physical exam. A pediatrician may also do a nasal swab test to determine if your child has RSV or another virus. Now, fortunately, health officials say that most RSV infections do go away on their own in a week or two, but we should know that RSV can cause severe illness in some people. So, a lot of folks want to know, is RSV worse than COVID? And why is there so much RSV going around now? Our guest this morning, Mobile County Health Officer Dr. Kevin Michaels. He's with, of course, the Mobile County Health Department. And after a quick break this morning, we'll talk with Dr. Michaels about the influenza-like sickness that's causing frustration for a lot of folk. And we'll also get an update on the trio that some health officials are calling the Tripledemic. And it has some of us concerned that this time of the year as we continue in this holiday season. Perspectives continues in just a moment. Our guest this morning, Dr. Kevin Michaels. He's Mobile County Health Officer with the County Health Department. Thank you for being here again. Good to see you.
Thank you.
This time of the year, of course, a lot of folks are wondering what's going on with the colds. I was talking to a mom maybe a week or so ago, and she was telling me that the RSV was going through the daycare. So you've got parents concerned about their little ones and their older ones, but RSV is also something that older folk over 60 should be, I guess, concerned about as well. So why don't you first give us an idea of where we are right now with what we're hearing from the county and state health departments.
All right, so in Mobile County, our data management team is looking at it, and approximately about 15% of all visits going into the ER are related to upper respiratory-like infections. And of the 15%, about 9% are influenza-like illness, and then about 5%, about 3.5% are related to COVID-like illness, and about 2% is related to RSV. Now that's at an ER, and most people are getting care through ERs or urgent cares, and we don't really capture the urgent care. So the experience of family members taking loved ones to a clinic, there may be increased wait time and a lot of sick people there. So we are seeing that.
Okay, so we definitely are we in the peak season yet, or we're just at the sort of beginning of?
You know, typically the fall leading into the winter is usually when influenza-like illness or upper respiratory infections start occurring. Last year this time, we sort of peaked out and sort of dropped down. We started in the August time frame and started going up to just after Thanksgiving and then dropped. This year we're a little bit slow. We're still going up. We're not as high as where we were last year, but we sort of, the numbers looking over the last week or so, we sort of peaked and going down now, but that's just based over 1 week.
Okay. And Christmas is ahead, right?
Exactly.
Are those family gatherings still fueling the, I guess, amount of the size of the outbreak?
Well, you know, typically, you know, anytime you bring people together, there's going to be a swapping of viruses or illnesses. You know, the child is sick, grandma and grandpa may get sick, you know, and it's the exchange of, you know, viruses or the illnesses that occur anytime you have a get-together.
Okay.
So it's the same thing when you go back to school. Mom and dad get frustrated. Kids come home with sick. And, you know, in the daycare center, yes, we've seen some RSV outbreaks. And a lot of times you go back, you educate, and remember all the things we practiced with COVID, the social distancing, washing one's hands. If you're sick, stay at home, practicing those same things, increasing ventilation into the area reduces the risks of the spread of viral illnesses.
And you probably noticed, of course, and I've noticed that more people seem to be wearing their mask right now this time of the year in places that have crowds, like the Walmart store, or you see them in the grocery store, people wearing their masks. Is that something you should consider if you are?
If you have risk factors that put you at increased risk, wearing some type of facial covering or a mask may be appropriate for their individual health conditions, or if they unfortunately were recently diagnosed with COVID and they're on that 10-day period after, during the COVID illness, they're supposed to wear some type of facial covering.
Okay.
To reduce that for about basically the first 10 days.
First 10 days.
5 days they quarantine, basically stay at home away from others, and then when they're feeling better, they can go out then for another 5 days and wear some type of facial covering.
After the madness we went through 3 years ago, and I guess up until about 2021, it seems like we've got more stuff to be concerned and worried about now, and we're talking tripledemic, adding the 3 in there together. Are people more concerned? Are you all hearing more things of people wanting to know what is this and how do I determine which of the 3 it is so I can address that? Well,
interesting. This is the first time in history that we actually have 3 good vaccines to address the triplet epidemic.
Okay.
I mean, we have a COVID vaccine that everybody should get boosted at least once. This year. We have the influenza vaccine, getting the influenza vaccine, and sort of the newer one now is the RSV vaccine, which is licensed or licensed for people over 65, which are at increased risk for RSV. And then we have some vaccines for the younger, newborn, 6 months, to get them vaccinated that may have increased risk factors from it. And then also, there's a vaccine for mom during pregnancy to, transfer antibodies during the pregnancy process to add to that newborn's life of further protection.
That sounds like a good deal there. Now, when you say historic, that is something to think about, that we've got vaccines now addressing the things that we're most concerned about. Now, when you look at the vaccines, is there a certain time frame that we should get those before? Let's say we should have gotten it beginning of November or in October.
Well,
is there a
typically
time frame?
the flu season, again, depending on your perspectives, typically they report starts from 1 October and lasts through March. Okay. All right, and so getting vaccinated during that time frame earlier is a good thing to start to be set for having the antibody production, because you get vaccinated, it takes typically about 10 to 2 weeks, 10 days to 2 weeks to develop the antibodies. So if you get vaccinated when the vaccine is available, September, you're ready for the flu season. Now, those people over age 65, there's a high dose vaccine for that age group to kind of give them a little bit of oomph to it. So some people talk about delaying. I'm not going to get vaccinated until the flu season starts. I'm one
That's
of those
not wise, is it?
No, it's not.
Okay.
And then the same thing for COVID. We have, this past fall, we have a new vaccine. It's an annual. It's the 23-24 COVID vaccine. Everybody should have been vaccinated for that.
When should we have done that?
When it became available.
Oh, okay.
Folks. I mean, it's available all year round, but now, we'd want to hit. We know that COVID's going to increase during the months that were the cooler months.
Okay.
But it's all year round.
Now, for someone who's watching today, should they go ahead and get all 3, or how should they go and make these happen for themselves?
Well, you could get influenza and COVID vaccine together.
Okay.
All right.
I've seen those
separate
commercials.
injection.
Okay.
Yeah, separate injection site. You can probably, if you're over age 65, you could probably also get the RSV vaccine, all 3 together.
Oh, okay.
Now the problem is when you get all 3 together, you might have a little bit more immune response. And so if you're one of those people that respond to a vaccine, you know, it may be a little bit more, ouch, that hurt.
Okay.
Maybe taking some Tylenol, you might have some flu-like symptoms for a couple of days. That's all normal response to vaccines.
Otherwise, they should maybe stagger every other week? Or
I'll
every
leave the staggering up between you and your primary care provider.
Oh, okay, right. Let the doctor.
I'm very much
got
a
you.
vaccine, you know, proponent. You can give all 3. You can give all 5. You can give all vaccines at one time.
Okay. As we did in the military, so you're used
exactly.
to that too. Okay. And that's, I don't remember any reaction. I guess they wouldn't have cared anyway, right?
No, we would have.
Oh, okay.
There's a sense, I mean, recognizing that when you get a vaccine, you're going to run you may run a low-grade fever, you may have a little bit of muscle ache in the area they gave the vaccine, and you may develop, you know, sort of some body aches a couple of days afterwards. A lot of people interpret that, oh, I got sick. I got my flu vaccine, and now I got the flu. That's a normal body response, you know, and if you take, you know, some Tylenol or acetaminophen, you know, that'll handle it and you'll be back to normal, you know, in, you know, a day or 2.
All right, we're going to take a break, and
Sure.
when we come back, we're going to talk more about COVID in today's language and time frame, as well as, of course, the Tripledemic. Our very special guest today, Dr. Kevin Michaels with the Mobile County Health Department. He is our Mobile County Health Officer. We'll be right back in just a moment here on Perspectives. Welcome back today on Perspectives. We're talking to Dr. Kevin Michaels, our Mobile County Health Officer, and he's talking about the Tripledemic today. We're sharing some information that hopefully will be very helpful to people making some decisions. Let's go over that once again briefly so we make sure we touch on it in both segments about the vaccines, historic time, where we've got 3 available for each of those, and how should they go?
We have 3. We have 3 vaccines available right now. You have your typical annual influenza vaccine, comes out every year. Typically comes out in the September-October time frame. We encourage everybody to get vaccinated sooner with the influenza vaccine. We also have a new, different from all the people getting the 5 or 6 doses of the COVID vaccine in the past, now we have an annual 23-24 COVID vaccine. So one-time booster, get that. And then the RSV for people over age 65. It's available, and for those people, for those women who are pregnant, getting vaccinated during pregnancy transfers the antibodies to the child, and it sets a child up for success. And there are some vaccines available for children at high risk in the younger age group. From that standpoint, you can get all the vaccines at once.
Okay.
But you know, you have to also look at how sensitive you are to vaccines. It's not to cause pain or discomfort, but if you can handle 2 vaccines, the influenza and the COVID, get them at the same time. It's a missed opportunity. You want to minimize going to the your healthcare provider.
Right.
So
there you go. That and the urgent care, stay hopefully healthy throughout the colder months of the year.
Exactly.
So when we talk about Tripledemic, let's break those down. What's going on with COVID? Where are we now with COVID? And since especially now you're talking about an annual vaccine.
Right now, you know, typically the Southeast, Alabama, we have low vaccination rates, but the vaccine has been getting out there. We also have, you know, kind of that herd immunity, the natural immunity that one gets from the virus. So realizing there's been a change in the reporting, so all we're really reporting when we say about 3.5% of COVID-like illness presenting to the ER, that's an estimate because what's actually reported or would be tracked, and we're in a low risk still status for our community, is those people hospitalized with confirmed COVID. So the cases of COVID, hey, I think I kind of feel ill, I get a test kit, I test, I'm positive, that's not going to be reported. Right. So we're seeing a small number in the hospital, but what's out there in the community, people are experiencing COVID-like illnesses.
And should they have any fears after what we went through, or today we've got it under control, so to speak?
We do have it under control. We have The test kits are abundant in the community. You can still go out and request from this, basically on the CDC website, request test kits.
Free ones?
They still are available
Okay.
for free. They're available at many of the pharmacies and food stores, so you can purchase them from that standpoint. And then we also have antivirals. And the thing is, if you get vaccinated, you reduce the risk of developing long COVID. All right. For those people, they get vaccinated and or are not vaccinated, and they get COVID-like illness or COVID, we have some 2 great antivirals that, unfortunately, come the 15th of December, they're going to be now on the commercial side, and so all the previous stocks, once they're used up, you're going to have to purchase it if your doctor decides to put you on those.
Right. So when you look at taking the test or being diagnosed with COVID, we don't have the same fears that we had previously, and so they know how to proceed with what the next step should be.
Exactly.
Okay.
And unfortunately, people who do get COVID, there's still people ending up in the hospital. So there are certain risk factors. Those people with cardiovascular disease, lung problems, and they know who they are, and they get COVID, their symptoms may be a little bit more severe, pushing them towards a hospitalization. Same thing with RSV, respiratory syncytial virus. If they get that and they have other health conditions, they could end up in the hospital. So that's all a concern that, when you look at the symptoms, the typical cold, you get better, you stay at home, but as soon as the person starts developing shortness of breath, having difficulty breathing, some of the symptoms you talked about in the lead into this, those are the people that end up in the hospital. And they could be end up in the hospital for influenza, or RSV, or COVID, or developing a pneumonia.
And that's the one I'm going to ask you a question about in a moment, because that's happening in some other places around the world, especially. So I guess the question I was going to ask you when you came out of that was to looking at, it's amazing where we are with so many things to address similar in nature. So how do you determine which one you have if you are concerned about how are you feeling right now?
Well, typically, we know we have the home test kits for COVID.
Okay.
So if you take a home test kit and it's negative and you're still feeling ill, that's when you go to the doctor's office. The doctor may take a culture from the nasal, from the nose area, or the back of the throat, and they send it off for testing, or they have a rapid test there in the clinic, and it comes back positive for influenza or RSV or the human rhino virus or enterovirus. So those are the rapid test kits from that. That still requires you going to a doctor's office.
Okay,
so if you have symptoms severe enough to take you there, that's what they're going to do for you.
Okay. Looking at, you mentioned pneumonia, and it brought back to mind there's a sort of an epidemic going on, or a rise in infections in China again. And pneumonia is one of the things that they mentioned too, along with the Tripledemic. Is that something that we're having to address here now?
Well, I don't know specifically what's coming out of China, but I would say that the public health community are looking for, the CDC and at that level are looking for telltale signs that, hey, we have a concern coming. We're always going to worry in the fall time frame of influenza-like illness, ILI, developing and what it means to the community.
So it's very important these days.
People are watching
and health alert on that, because when I saw that story, I was saying, oh my goodness, hopefully not here we go again, but hopefully that we are on watch and on alert now. And I'm sure, is that what's going on through the health departments where
yes.
you all have?
I mean, that's occurring across the community. People are watching the numbers. As soon as they start approaching up, we're going to look and start investigating on that. Now, just kind of go back, we talk about influenza across the state. The influenza is present in many of the counties, basically all the counties across the state. And but what's reportable are influenza deaths, not people coming down with influenza. So what they're going to say is, we have approximately 8 to 10 people die from influenza illness.
Which you all shared that when the COVID broke out, that we typically lose people every year to flu and influenza.
Exactly.
And so one of the tissues.
But that's what's reportable.
Right.
RSV is not necessarily reportable unless it's associated with an outbreak.
Okay. What about hospitalizations? Maybe they report RSV.
Well, that's picked up in our surveillance, but that's not necessarily reportable from.
We've got about a minute left. What message do you want to leave to the community in reference to making it through this cold and flu?
Just remember, just remember the basics. If you're sick, stay away from others. Wash your hands. Do terminal cleaning of all the things that you may come in contact with, and in cases, practice social distancing, and get vaccinated.
All right. Well, we thank you so much for taking time to break it down for us, because it's always good to hear from our health officer in the county. That's very important. Dr. Kevin Michaels, our guest today, of course, on Perspectives, and you can run this over and play it over again to get all that information. And also, for more information, go to Mobile County Health Department. They have a downtown health center, main office there on North Bayou Street. The hours are right there for you, as well as phone numbers to call for more information. And then for your general questions, info@mchd.org for all of your things that you want to know more about. And of course, they're on many social media platforms as well. Well, remember, you can find all of your episodes of Perspectives on fox10tv.com. Of course, we're on several of our social web platforms and sites, so you can also find us there as well. Thanks for joining us on this latest edition of Perspectives. I'm Eric Reynolds. We'll see you next time. Until then, you have a great week ahead.